In this video, we will talk about PCOD, that is Polycystic Ovarian Disease, which is very common nowadays and mainly seen in young females. Okay, so first of all, what is Polycystic Ovarian Disease? This is a gynecological disorder. Okay, this is mostly seen in young females. Okay, you can imagine a beautiful young girl, okay, but when this disease strikes, okay, PCOD strikes, what happens is she gets like totally converted to young female, or I should say young fatty hairy pigmentations, okay, female. So you can imagine that creates a havoc in one's life. So why it occurs? It occurs because of estrogen dominance. Okay, so main culprit here is estrogen. So how to characterize the disease, or how we can say that this female is suffering from PCOD? There are three criteria, that is, there is oligo ovulation or N ovulation. That means the ovulation is occurring infrequently or it is not at all occurring. Okay. Other feature is polycystic ovary. That means there should be more than 12 ovarian cysts at a time, and that should be like 2 to 9 mm size or 10 ml ovarian volume, and these are the USG features. Okay, I will explain you, don't worry, in the diagram. Then there is hyperandrogenism. So let's discuss one feature one by one. So this oligo ovulation, N ovulation, will lead to irregular menses. Irregular menses, and this menses will be heavy whenever they will occur. Okay, and it will be painful also. So there may be dysmenorrhea. Dysmenorrhea means painful menstruation, and it will be irregular also. Okay. Then polycystic ovaries means, see this diagram, this is the USG feature. You can see that this is our ovary, this is the patient's ovary, right? And you can see this small cyst. There are like dozens of cysts here, okay, and they are arranged peripherally like a string of pearls. So there will be string of pearl appearance in USG. You can see this diagram. Just see this ovary. There are so many, there are multiple cysts, and the ovary has also become this bumpy because of this cyst. You can see that this is a pathological specimen. This is the specimen which is cut. Okay, this is fresh specimen and it is cut likewise. Okay, in cross section, and you can see the cross section. And this is the histopathological appearance. Okay, these are the cysts. This is the ovary. This is the stromal component. This is the periphery where follicles are arranged and they will become enlarged. So this is discussed, this is discussed. Now there is hyperandrogenism. Because of hyperandrogenism, what will happen is there will be hair growth in female. Okay, and this hair growth will be like male pattern hair growth. Okay, so there will be hair growth on the face, okay, like in the jaw lines, okay, in the chest region, and there will be so much growth of the hairs that it will look like the male hair growth pattern. Okay, and there can be acanthosis nigricans, that is there will be pigmentation at the nape of the neck, okay, because of this hyperandrogen. And if you see that female will be fat, okay, so fat female, right, who is young, okay, hairy, with irregular menses, right, pigmentation in the body. So this disease makes a female look very much you know not acceptable by her, like she won't like her look, okay, because of this disease. And uh, like we as a doctors, we know that yeah, this is because of this PCOD, but this young females, okay, they are at, like they will be like 19 20 years or so, and they won't be able to know that yeah, they are suffering from this disease, okay, and many a times they just keep on suffering, and they don't show or go to any doctor, okay, and because of that this disease keeps on aggravating, okay, and ultimately this can also lead to insulin insufficiency, and there can be diabetes also in this patient, okay. So and this can cause infertility also, because you can see that these follicles that are growing, okay, they are not rupturing, there is no ovulation. If there is no ovulation, then there will be no fertilization, okay. So when this female will try to conceive, okay, there will be infertility. So this is creating very much social stress to the female, and so this disease should be recognized at a early time, okay, earlier, and it should be treated well, because we have the treatment for this disease. So it is not that this disease is not treatable, that this is very much treatable. So as a doctor, it's our duty to identify this disease, okay, and to guide our patient, because you can see that this is a social havoc to any girl. So for this, you need to understand this disease, you need to recognize the features, okay. So there will be irregular menses, there will be pelvic pain, I have already told you, there will be anovulation, there will be irregular menses, and whenever there will be menses, okay, there will be increased pain, okay, because of all the hormones, and because of the increased growth of the endometrium, okay, that endometrium will be immature, and at the time of the menses it will release more and more prostaglandins, okay, and this will lead to pain. There will be so many small cysts in the ovary, and if cyst, okay, this cyst can even there will be bleeding in this cyst. So there is many a times this patient of PCOD can come to us as a sudden pain, okay, overnight sudden pain, and when you do USG, you can find that there are multiple cysts, and one of the cysts has undergone bleeding. That is a hemorrhagic cyst. So this type of patient can also come. Then there will be acne, I have already told you, because of hyperandrogenism. There will be weight gain, okay, this is the vicious cycle. What happens is, patient is fatty, right, and because of this there is increased estrogen. Now this estrogen in turn cause one to be fatty, okay. So this fat promotes estrogen, and this estrogen promotes fat. So if patient loses weight, okay, patient decreases the fat content of her body, okay, then this estrogen won't be able to thrive, and this disease can be cured. So a very easy, and like it's a first line treatment, that is weight loss, okay. If patient loses weight, then there will be not much fat for the estrogen growth, okay. So ultimately estrogen will come down, and all the symptoms will go, Okay, so this is the first line treatment, that is weight loss. Then there will be heavy bleeding. I already explained you this. There can be headaches, infertility because of anovulation, elevated BP, hair growth, hirsutism, male pattern baldness because of androgen, right, and decreased libido. So these are all the features. So let's discuss the treatment. So treatment is weight loss, right? Then we can also give them OC pills. Why OC pills? Because this will regularize their menstrual cycle. If menstrual cycle will be regularized, then estrogen and progesterone hormone will also get normalized. Okay, and this will help the patient with excess estrogen. And we can also do surgery, but that is like last resort, right? They will just use the lasers and they will just kill these follicles. They will become, that have become cyst. Okay, but this is not done usually. The patient will be treated well if she loses weight. Okay, and if this doesn't work out, then she is given OC pills also. Progestins can also be given. Okay, and if nothing works, then surgery has to be done. Now if patient has diabetes like features, then metformin can also be given to this patient, and this metformin will also help them weight loss. Okay, so a patient with PCOD who is fat, right, plus there is also diabetes mellitus like feature, then you can give them metformin. It will be very much useful to them. So yeah, that's all for this video, and don't forget to like, subscribe, so that you don't